Good day. It's Amy K. Gaskin, Aging Maven Aficionado, live on Ask Amy About Amy. Ask Amy About Aging. We all know about me, with Dr. DeLon Canterbury. Today we're going to be talking about genetic testing and the medications. So welcome once again to my show. And why don't you tell everyone a little bit about yourself?
Hey everyone, my name is Dr. DeLon Canterbury. I am the founder of Geriatrics. I'm also a board certified geriatric pharmacist and trained pharmacogenomics consultant. So yes, we'll dig into that today as well. Thanks for having me on, Amy.
Yes, well, welcome back. And so I was very eager to talk about this because I know that certain medicines work for some people and certain medicines don't. And so I really want to learn more about this genetic testing that you offer.
Yeah, so one thing about our company is we require our patients to get a genetic test, and that's a part of our medication review or deprescribing action plan. So what does that really mean, right? So we're not really talking about a 23andMe ancestry test. We're talking about a specific cheek swab that's delivered straight to your home, and we're able to get a report that tells us how your body may break down certain medications. Now, generally, we're talking about the liver. When the kidney and the liver are the ones that break down meds. But this report's able to tell us basically if you're going to be a poor responder or great responder to certain opioid medications, right? We have a lot of variability there. A lot of it can fall into play with mood medication, so anxiety, depression.
Mm-hmm.
A lot of those have a genetic component that can tell us whether a one drug versus another may work better for you or versus for someone else. So this is the field of precision medicine. So it's a growing field where it's actually covered by original Medicare and Medicaid in certain states. So
Mm-hmm.
insurers are catching on to this new form of being more precise with our medication prescribing habits.
I would imagine that it saves them money in the long run too, because they're paying for medicines that aren't working. So somebody might have a medicine for like a week or two and not use the rest of it, but the insurance company paid for it. If it's not covered on insurance, what does it normally cost?
Well, that's a great question because before it was really it was just really unaffordable for people.
Right.
Right now, you can get it anywhere between $150 to upwards of maybe 525, but
Mm-hmm.
most tests out of pocket are about $300, 325.
Okay.
So they're really more affordable now for those, and a lot of them are starting to have patient assistance foundation, so they can basically make the copay a bit cheaper for people who may be low income or just
Right.
can't afford it in their budget. So
But the insurance will cover part of it.
the insurance, particularly original Medicare
Mm-hmm.
and some Medicaid plans, as long as it's written by a supervising physician or medical doctor that sees a need for it, it's completely covered.
Oh, that's awesome. So why don't you tell us a little bit more about some things that you've experienced when you with patients, like a story that like, hey, I took
Yeah,
this person off medicine. How did it affect their life?
sure. No, yeah, it's an amazing tool. And for instance, I can talk about my own, right? My family is from the is Guyana in South
Mm-hmm.
America, so they're Caribbean background. And when I got my test, I found that there were four genetic markers that I have that are basically intermediate. So basically, there's a scale of four measures. There are people that can rapidly break down a drug, right? There's some people that are considered regular drug breakdowners, so the average population.
Mm-hmm.
There are people that are poor, right? That means they just can't even get the drug through the body for it to even work. And then there's some that basically are ultra rapid and it's gone out
Right.
like that. So I found out that I am intermediate. And what that means for certain genes is that for certain pain medications, I cannot break down codeine or hydrocodone very
Right.
well because I have an intermediate blockway. So I see it as like a highway analogy where there's a dirt road and there's, a 5-lane freeway. So the 5-lane freeway are like your ultra rapid metabolizers, and the dirt road is kind of your poor metabolizers, and the drug just can't. It won't get there as quickly. So that's one way I like to describe it. But pain, opioid medicines, you notice, right? People can be zonked out on one oxycodone, or some people need to have 10 to feel a little bit of pain relief.
Right.
There's a lot of subjectivity in pain, but a lot of pain pathways have markers through cytochrome. Well, 2D6 is the shorthand for it, but basically it's a liver enzyme that clears the drug. But it's the same for a number of different classes of meds, right? We're talking like statins has a genetic component. A lot of, again, depression medications, a lot of cancer therapies are based on a genetic marker. So it's not new science, but it's becoming more accessible. And it's been around since the early 2000s, since the initial first human genome project. But now pharmacists are actually taking and paving the way as entrepreneurs and using this genetic testing to consult in healthcare clinics and long-term care facilities and patients that may have like a blood thinning disorder, right? Like a warfarins, right? Or clopidogrel. They need blood thinners. And there's some people who just cannot get that effect. So that's particularly seen in Asian populations, people of Han ancestry. They have this poor metabolizer marker for a commonly seen drug, a blood thinner called clopidogrel or
Mhm.
Plavix. It's basically like an aspirin. It just keeps your blood loose. But we find that people of Asian ancestry have a higher chance of not being able to clear that drug. And sadly, that means they can have a recurring stroke or a heart attack because
Wow.
of their genetics. So that's the piece that was honestly missing in our healthcare system. We can't assume that every pill is going to work the same way for
For
each group.
everybody. Yeah. Now, I know that a lot of times they want to, especially if you're going into for surgery and stuff, they want to check your weight, and there are some people that are very heavy and obese, and yet the medicine just interacts with them right away.
Mhm,
So weight it isn't usually in my because like for instance with me, I'm 5'10" and I'm not tiny, but
mhm.
medicine just totally affects me right away. Like even alcohol, like I'm not a big drinker, and I drink maybe one drink a year, and I'm happy and I'm fine with one, but I can't but some people can drink 10 or 12 drinks and not feel anything.
Yeah, I mean, I think that's a great metaphor for how drugs are, right? And what we can break down is just going to be based on our body. And that's why uh, precision medicine, genetic testing, pharmacogenomics, they all are ways to just provide more clarity. For instance, I've had patients who, similar to that story with the Asian people in that gene, he had the same marker. And this patient of mine, he had a stroke, went to Duke. They put him on clopidogrel, the same drug. A week, 2 weeks later, he had another block in his lower leg, and they ended up realizing that he cannot take clopidogrel because he has a genetic deficiency. So he has factor 5 Layden's disease and factor 2. And factor 5 and factor 2 are basically your clotting factors. So they're basically what make blood clots in the body. And that's when if you have a cut, it basically comes to the rescue and it gets a scab. He has a deficiency in those two things, meaning he can't form those blood clots, and it's genetic. And I was able to see that he has a genetic marker for that from this very
Yeah.
same genetic testing report we did years later after we found out he had that issue a couple years back.
It's amazing that it's not required. Like everyone should have it. I mean, like it should
Agreed.
be something simple. It should be a law passed. You need to get this. If you're going to be taking any medicine, especially 5 or more medicines, then you should have to have this genetic test because, we don't want to be wasting the, Medicare, Medicaid
Sure.
money or even in person's personal money on
Mhm.
medicines that aren't going to work or make someone worse.
Yes, no, I completely agree. I will say that not every single drug has a genetic factor related because some drugs are just cleared through the kidneys or through your fecal matter. So there's some that you don't have to worry about. But to be honest, my philosophy is the same. I think everyone should have this. It's accessible, it's relatively affordable. and insurance is covering it more. So to me, I think we should have everyone in knowledge of this, especially those in underserved communities who may otherwise not even have a clue about this, right? So
Right.
having it equitable and accessible is important.
And especially if you're of a certain ancestry, because those
Exactly.
things, like I would imagine that there's some ancestry lines that should have it more than
Mhm.
others, right? I mean, because there's a lot more genetic factors in that
For sure.
race. Yeah. Interesting. So, well, I'm so glad that you came on today. Is there anything else you want to talk about or add to this genetic testing?
Sure. Yeah. So genetic testing is pretty critical. We have to understand that yes, there are there are drug interactions between meds, but there are also gene drug interactions. And so sometimes you may have a medication that isn't cleared, or you have a medication that actually interacts with a gene, and it basically compounds your genetic piece with the drug interaction. So what I'm trying to say is this isn't going away. Genetic testing is growing. There are companies growing ever expansively in this field, and if you're curious about it, I think it's worth asking your doctor if you have a medicine on your profile that would be worthy of a genetic test, just to see if
Right.
it can help with reducing the trial error, reducing the side effects, reducing the time you waste and not having your condition treated because you're still figuring out what the sweet spot is. So
Right.
that's where genetic testing is the pharmacist, I think, a superpower of ours. We're trained in that clinically to know what this is. And so you'll find out that not a lot of medical providers are aware of genetic testing or may not be aware of how to interpret a test until it's like taught. So that's the piece in medicine is unfortunately we have all this cool science, but it doesn't get adopted until decades later. So just have a little grace, but there's tons of information about that. And if you have questions, I'd be happy to address them if you reach out personally.
Right. And then I was just thinking that when you go on a medicine or come off a medicine, they sometimes like graduate you on the medicine and then graduate you off the medicine. If there's a medicine that you're on that a genetic test said, whoa, we shouldn't be on, you don't stop that cold turkey, right? You still have to do you prescribe the right way?
Completely right. You definitely don't want to stop most things cold turkey, although there are some medications you absolutely can, but there are certain ones you definitely don't want to stop cold turkey. So you want to make sure there is a supervised and strategic plan on tapering people off and getting people safely off the medication.
Okay. And if somebody, let's just say that they've had a condition that was like that makes them dizzy all the time,
Mhm.
and then if a doctor is prescribing medicine that the side effects is dizziness, that's not gonna help that person. So, would the pharmacist be better to consult with a pharmacist so we can help educate the doctor? Because if someone's condition keeps getting worse every time the doctor changes the medicine,
I think the pharmacist is great at identifying side effects. So I absolutely think that's a good option. I think the doctor is also a good option in that instance because they're going to know what was just started. And if they may not know all the side effects, but if the patient's still complaining of it, then I think the doctor will know just as well
right?
what to do in that situation.
All right. Well, I look forward to having you back on again. And
Awesome.
so thanks again for coming on to Ask Amy About Aging. And again, I was speaking with Dr. DeLon Canterbury. And I hope to hear from you soon and have a great day.
All righty. You too. Thanks.